Hi, I am Dr. Shashank Arora. I am a BDS and an MDS. I'm an endodontist by profession, but I also specialize in implantology. So today we're going to discuss about dental implants and in particular conventional dental implants. Now first you need to remember what you see in your mouth are the crown part of your teeth. What you don't see are the roots of your teeth. Once your roots of the teeth have gone bad or they may have been diseased or fractured, the teeth might need to be removed. Something now that replaces the roots of your teeth are known as dental implants. Dental implants are basically titanium screws which are inserted in your bone. They combine with the bone and eventually you get a teeth on top. Just to give you a brief idea about dental implants, a dental implant is nothing but a screw. It has a part of screw which is inserted in the bone. Then there is something known as an abutment which is inserted on top of the implant. And once the implant is nicely fixed with the bone, which is known as osseointegration, which may take place between 3 to 6 months depending upon every different condition. Once that is ready, then a crown on top is placed. So generally, if you have lost one teeth in your mouth, we require one single implant. Or if you have lost a little segment, you might require 2 or 3 implants. But in cases where all of your teeth have gone bad, you might require 4, 6 or 8. So this is known as an all-on-X concept that we follow these days. So every case is different. You might require 4 dental implants on each jaw. You might require 6 dental implants on each jaw, or you might even require 8 at times. Now today we'll discuss in detail about the all-on-4, all-on-6, or today more popularly known as the all-on-X concept. Now before getting into details, I'll just like to give you a little history. Before, an all-on-4 concept was introduced in which 4 implants were placed in each jaw and some teeth and fixed permanent teeth were given. Slowly and slowly, this concept changed to all-on-6. Slowly and slowly, it changed to all-on-8. Now, the concept is known as all-on-X tilted concept, in which we use the same amount of implants. Either it can be 4, either it can be 6, but you may use in different directions. Now, you may be aware that the dentists, they place the implants very straight in your jawbone. But now in all-on-X tilted concept, what we do is we utilize the more amount of your bone by tilting the same number of implants. So 4 implants can be tilted in different directions and a better result can be achieved. 6 implants can be tilted in different directions and a better result can be achieved. This totally depends on the design and the type of the bone that you may have. In some cases, the sinus that you may have on your upper jawbone may allow us to put only 4 implants, or the sinus position may be such that it may allow us to put 6 implants in a bone. Now I'll discuss with you the procedure on how an all-on-X concept is done on you. Once you land up at our place, the first thing that we will do is we'll do an investigation, a thorough investigation of your body, a general health checkup. You might be suffering from diabetes, osteoporosis, or you may have any history of any systemic disease. In such cases, we'll first do a thorough checkup, take a blood test, and see what conditions, at what condition you are currently. The main purpose of doing a general health checkup is, I'm sure you must be having a doubt in your brain also, of diabetes. Yes, in case if we find out that you do have diabetes, or if you do give a history of diabetes, the only thing we need to check whether your diabetes is under control or not. If currently your diabetes is under controlled within the normal limits, we can definitely go ahead with the procedure. But in cases if your diabetes may be fluctuating and not under control, in those cases we might have to wait, get your diabetes in your under control, that is your blood sugar levels under control, and then we might be able to proceed with the procedure. Once we do get your diabetes or your blood sugar level under control and we go ahead with the procedure, it will be very, very important for you to maintain your blood sugar levels. Your regular exercises, your dietary maintenances, and your medicines will always make sure that your blood sugar levels are under control. Once that is maintained, the procedure that we do will always be successful. Now, considering all your overall health is under control and you're ready for dental implants, next what we do is we take you for a radiographic examination of your jaw bones. We do a OPG and a CBCT to check the height and the width of your bone. Once that is suitable, That determines us to use which type of implants, the design of implants. The all on X concept now comes into play. Once we know the design of your bone and the type of your bone, we now decide how many implants are suitable for you and the design of the dental implants that will be placed. For example, we might place straighter implants or we might place tilted implants. Once everything is ready, a treatment plan is set in place, you are now then ready to go on the chair. Once you're on the chair, we'll start by injecting local anesthesia. The local anesthesia is administered. Once it is done, you will be waited till you're totally numb. Once you're ready, we start placing dental implants by opening your gums or opening the flaps, and we carefully place the dental implants as per decided during the CBCT examination or the OVG examination prior to the procedure. Now, the implant placement surgery may take a couple of hours, and once the implants are placed, the first objective that will be in our mind is to give you some teeth so that you can eat. Now, please remember, there is a provision that we can provide you temporary teeth within a day itself. So, if you are suitable candidate for providing your teeth on the same day, you might do that, or we might wait a couple of days for that procedure. But definitely in a couple of days, we will give you few temporary teeth which will allow you to smile just like before and eat some soft diet. Now we are at a stage when you have dental implants in your mouth, maybe 4, maybe 6, maybe 8. And now we are ready to give you temporary teeth. Please remember, these are temporary teeth that we'll be providing you, as these are conventional implants. Conventional implants are to be remained in the bone for the next 3 to 6 months, depending upon the quality of your bone. As these implants, they require to become stable with your bone, they require time to integrate with your bone. But till the time they are integrating nicely, we provide you temporary teeth. These temporary teeth will allow you to only have soft food. They do not definitely replicate the final teeth. They will only replicate some plastic teeth which will allow you to have some soft food. Once this procedure is done, you're off back to your home, and then we will see you again after 3 to 6 months, whenever according to your availability and according to the current situation of your implants. Once you're back with us, suppose after 4 months or 5 months, our job would be now to remove your temporary teeth and give you permanent set of teeth. The permanent set of teeth may be of different types which you may have selected. It can be zirconia or it can be porcelain fused to metal. Whichever teeth you may have selected will be provided to you by this procedure of prosthetics. Just to give you a brief idea on how you will maintain your teeth with all on 4, all on 6, please remember that these are conventional implants and way different than the basal implants. In the other type of implants, the teeth which are there, they are cemented on your implants. In this case, in all on 4 and all on X concepts, your teeth will be screw retained. That means the implants will retain your teeth with the help of screws. So for maintenance, not only you will have to brush your teeth, not only you will have to use a water flosser, you will have to visit a dentist every year so that a dentist can remove your teeth with the help of screws, clean them properly, and then place them back. So this is the biggest advantage of using conventional implants, that these teeth can easily be removed and they can be cleaned and placed back again. So this is the most important factor in maintaining conventional implants. So this was all about all on X concept and all on X tilted concept. For any other further queries or any questions you might have, please contact Cure India and we'll solve your query as soon as possible.
If you are interested in treatment in India, please subscribe to our channel and press the bell icon to never miss a new video from us.